Hey, this is Lynn. I am here today to talk to you about IBS or irritable bowel syndrome. And it's not IBD. You may see that sometimes. IBD is inflammatory bowel disease. So Crohn's, ulcerative colitis. And I've been on the carnivore diet. This is my 21st week. But for those of you who are fairly new to my channel, newly subscribed, you may not have gone back and looked at my original videos where I shared a little bit of my background. So I'm going to go ahead and just kind of get you caught up a little bit. So I recently retired back in February of this year, 2023, from nursing. And I spent part of my nursing career working in hospitals, but the last 7 years of my nursing career, I worked in outpatient medicine, specializing in gastroenterology and hepatology. So the area of the whole GI tract, the liver, the pancreas, everything that aids in digestion, that's the area that was my area of expertise. So I was a GI nurse, talked to and helped thousands of patients over the course of that 7 years. So I figured, well, why don't I weigh in on the whole irritable bowel syndrome topic? Now, this is not necessarily going to be specific to those on a carnivore diet, but I will discuss the carnivore diet because it's been shown to help. But I'm going to dig in a little bit and kind of go through some of the details about why I think that it actually helps with irritable bowel syndrome. So if you don't know what irritable bowel syndrome is, it is what they call a functional illness. So it's not like inflammatory bowel disease. There's actual inflammation in the colon. And for Crohn's, it can go all the way up the GI tract through small intestine, esophagus, and even into the mouth for people who have it in a very severe form. It is visible. Most of the time, the doctors can see it on a colonoscopy, upper endoscopy. There's actual structures on a cellular level that the pathologist can see with Crohn's disease and ulcerative colitis. The difference between the two is that ulcerative colitis is an inflammatory of the more outer lining of the colon. For most people, it sticks in the descending colon and the rectum, but it can encompass the entire colon, but it does only impact that first layer. And when they look at it on the colonoscopy, it looks like solid red. Whereas Crohn's disease, when they do a colonoscopy and they see the inflammation, it's very patchy. So there'll be red areas and then normal areas, red areas, normal areas. It can affect the whole GI tract, and it goes through in the full thickness of the wall of the colon. So there are some additional risk factors with Crohn's disease. For example, developing abscesses and fistulas. Irritable bowel syndrome, if you have gone to a GI doctor, a gastroenterologist, and you've had abdominal cramping, you've had either constipation, diarrhea, or alternating back and forth between constipation and diarrhea, you may have gotten the full workup, which usually includes a colonoscopy. Doesn't always include an upper endoscopy, but it usually will include a colonoscopy. And irritable bowel syndrome cannot be seen on a colonoscopy, but it's important to do one because they need to really make sure that there isn't something else going on. There's also something called lymphocytic colitis that isn't visible visibly when they do the colonoscopy, but they take biopsies around the colon and it's visible under the microscope. So it's really important to actually do that step. But I've talked to so many patients who they go through their colonoscopy and the colonoscopy is normal, the pathology is normal, and the doctor says, well, it looks like you have irritable bowel syndrome. And some patients are like, okay, I understand, I get what that is, okay. And other patients are just so mad because they're like, wait a minute, you're telling me you don't know what's wrong with me, and so you just slap a label of irritable bowel syndrome on it. Then that is absolutely not the case. Irritable bowel syndrome is very real. It can be incredibly painful and very life-altering. So hopefully you didn't stop with the being upset about the diagnosis. That's why I was really glad where I worked. We had a whole team of GI nurses, and we would get the calls from those patients that were just so irritated because why are we just slapping this label on me? And those calls would come to our nursing team, and we would help them to understand that it is a real serious diagnosis that we take very seriously. But what the issue is really is it's more of a neurological problem than an actual tissue problem. And that's why they call it a functional illness, because we have something called the vagus nerve, and with the vagus nerve it's responsible for regulating so much, and it's the longest nerve. It starts up it's a cranial nerve. It starts up and goes all the way down into your GI tract. And the vagus nerve is what's responsible for peristalsis of the colon, which moves your food through. Now, I used to tell patients, next to the brain, the GI tract has the most nerves in the whole body. So your GI tract is so full of nerves. Now, some people can have hypersensitive nerves. Every little thing that goes through there, feeling it, and they're in pain. But when it comes to irritable bowel syndrome, it is thought that there's a miscommunication between the transmission of signal between your colon through your vagus nerve to your brain. And sometimes that peristalsis is slowed, so people end up constipated. Other times the nerves are overactive and they're pushing things through too fast, and people end up with diarrhea. Or loose stools. It's not always like diarrhea or like runny diarrhea, but either loose stools or increased stool frequency. There's pain often before, sometimes after having a bowel movement. It can be intensely painful, very like double over cramping pain that occurs. So it's not fun at all. Now, once you've been diagnosed with irritable bowel syndrome, you may be given a medication called dicyclomine, which is an antispasmodic medication, which to kind of helps calm down the nervous system and kind of relax things so that hopefully your cramping will go away. You may be told to make dietary changes. You may have heard the concept of a FODMAP diet. So FODMAPs, and I always have to write this down because I always forget, but they are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. Now, these are naturally occurring molecules that happen they're in food. They're just naturally occurring in food. Some foods have more of them than others. So FODMAPs have been shown to affect irritable bowel syndrome. There's a leading university called Monash University in Australia that has done so much research on this, and they're the ones that discovered that FODMAPs have an impact on irritable bowel syndrome. So you may be given information about doing an elimination diet and eliminating the high FODMAP foods for a period of time, and then adding one category back at a time and just seeing how your body responds. I've coached people, many people, through how to do this diet. And for some people it works, and for other people it doesn't. Since I've become a carnivore and I've learned more, I think I have better insight, and I wish I had known this more, when I was actually working as a GI nurse. But I have some other information now that I think sheds a little more light on why it doesn't always work for people. They may be told to take a laxative if they're constipated. They will probably be told to use fiber to help regulate their bowels. So there's all these. That's pretty much the typical treatment that you would come up with. Now, fiber. I mean, as carnivores, we don't need any fiber. And when you're not a carnivore, you're probably being told, yeah, the fiber is super important and it's really essential to your diet. Most people probably don't know that there really isn't research supporting that. But if I was still back before I was a carnivore working as a GI nurse, I would be talking to people about insoluble versus soluble fiber. And with insoluble fiber, it's the kind that just goes right through you. You can't digest it. It's actually well known that it tends to trap minerals and vitamins that you need. And pulls them out of your body more than it should, doesn't let you actually absorb all the vitamins and minerals that you need. But it's being prescribed as important for the GI tract by GI doctors. So you need to increase that insoluble fiber if you're having constipation, or decrease it if you're having diarrhea, because it will speed things up. It'll get things moving. Those examples are beans, nuts, wheat bran, whole wheat flour, vegetables, especially green vegetables, berries. And then soluble fiber turns into a gel in your gut that feeds the good bacteria. It also helps with regulating your bowels. You're supposed to increase that also if you're constipated, decrease it if you have diarrhea. So you can kind of mess around with the ratio between soluble and insoluble. But I would, and that for examples of those are like apples, barley, beans, carrots, citrus, oats, peas, psyllium. So I would be coaching people on how to manage their irritable bowel syndrome with all these different things. There's one more thing that I would always tell them, but I'm going to get to that later. So one of the things that's missing from this, which I feel is really important, is avoiding oxalates. Now, oxalates are known to, I don't know if they cause, but they're contributing to irritable bowel syndrome symptoms. And this is something that through the 7 years that I worked as a GI nurse, I never heard anybody talk about oxalates. And they are plant toxins. And to my knowledge, they're the only plant toxin that you can't peel off the vegetable or the fruit or cook out of it. It's just there. It's naturally existing. It's one of the ways that the plants defend themselves. Now, there's other toxins too. I'm going to focus here on oxalates. So when I look at the different fibers that I just read off, so many of them are high oxalate. Beans, black beans, great northern beans, navy beans, pinto beans, soybeans, they're all very high. One of the worst offenders as far as oxalates. Almonds and peanuts are as well in the nut category. Wheat bran is very high oxalate. So whole wheat flour obviously is going to be high oxalate. A lot of the greens. Now, regular lettuce like romaine is lower oxalate, but a lot of those healthy, quote unquote healthy greens are very high oxalate. Spinach, collards, arugula, all the little baby mixed greens that, we love getting and making into salads. Those are all some of the worst offenders. Blackberries are a very bad offender. So there's so many of these things that are being recommended. And the doctors would always say, start with getting more dietary fiber. And if that doesn't help you, then add something like Metamucil. Now, Metamucil is actually low oxalate. It is made out of psyllium, and the psyllium is low oxalate. So if a person is focusing on all these other foods that are supposed to be a good source of fiber, but they're eating all these foods that are high in oxalates, which actually contribute to their IBS symptoms, they're not going to really feel better. I mean, this is kind of given the wrong medicine for the condition. This is not the medicine you need. So if you're not a carnivore and you're trying to deal with getting more fiber, I would skip all of this stuff and just do the Metamucil, because at least it's low oxalate. Ultimately, the carnivore diet has been shown to help so many GI issues and to heal the gut and to help neurological issues. So it is actually, a lot of people do end up finding relief from their irritable bowel syndrome when they do the carnivore diet. But for the non-carnivores, watch your oxalates. If you want to learn more about oxalates, I would definitely recommend, and I have it here, Sally K. Norton's book, Toxic Superfoods. I'm in the process of reading it. Very good. It gives every bit of information you need to know about oxalates. So that is a really good resource for you. Okay, so one of the things, so when I'm talking about like why I think the carnivore diet is helpful for irritable bowel syndrome is, first of all, you're not eating anything with oxalates. You're not eating anything with FODMAPs or lectins or other toxins that contribute to gut inflammation or nerve dysfunction. All those foods are out of your diet. So that alone is going to be a plus. The carnivore diet also helps with depression and anxiety. Now, there's a huge connection between irritable bowel syndrome and stress. The mind and the gut communicate with each other. And even the bacteria in your gut are part of sending those neurotransmitters, the signals. So the mind-gut connection is very real. Now, I remember we would have some patients that, all the different things that we tried wasn't working. So a doctor might try a medication called amitriptyline. And there was always going to be somebody who would call really upset and accuse the doctor of trying to tell them that their IBS is just a problem with their mental health. Because amitriptyline is a tricyclic antidepressant. But just like so many other medications, there are off-label uses. So, I would usually explain to them, Viagra used to be a blood pressure medication. Metformin is used for regulating blood sugar. It's also used to help polycystic ovarian syndrome. There are many, many, many drugs like that. Amitriptyline is one of them that has been shown to be helpful. You have to kind of titrate the dose, but it has shown to be helpful for irritable bowel syndrome because it does act on the neurological system, and that connection is real. So usually once I explained that, most people were fine with it. And they said, "Oh, okay, I just didn't understand." But the carnivore diet helps with depression and stress, and just the fact that there's so much of a connection with stress in your gut. That is a benefit as well to the carnivore diet. It can help with irritable bowel syndrome. It also helps with inflammation. Now, again, IBS is not an inflammatory condition. IBD is. But it's going to help your overall body with inflammation. And if you have an issue with your nervous system, inflammation can be anywhere. So it's always a good thing. So I think that those are some contributing factors to why the carnivore diet does help with irritable bowel syndrome. So if I was to give advice, if I was back working as a GI nurse, which I'm not anymore, but I would definitely recommend the carnivore diet because you're eliminating the oxalates and the FODMAPs and all of those other things that can cause problems and aggravate the irritable bowel syndrome. I would say, to adjust your fat intake depending on if you have, diarrhea versus constipation. If you have constipation, adding more rendered fat can help. If you're having issues with diarrhea, obviously stick with the cold fats that are, not melted down. Rendered fats are like melted fats. So stick with the colder fats, the solid fats instead of the liquid fats. Definitely be drinking plenty of water. Make sure you're getting exercise. Make sure you're getting adequate sleep. And then the last thing and this is something that I would recommend, and I did recommend for patients before, your breathing is very important. And I used to recommend something, and I would still recommend something called square breathing. Some people call it box breathing. But the reason why this technique works is because vagal tone is important. So when you have low vagal tone, the communication along your vagus nerve is going to be dysfunctional. And there are ways for you to increase your vagal tone, vagal tone to fix that. And one of them is diaphragmatic breathing. Now there's other ways too. You can sing. You don't want to hear me sing. You can laugh, which is always good. Like, why do you feel better after you laugh? You can go from having a bad day and then you can laugh and all of a sudden you feel better. It's because it really does communicate that action, that physical activity of laughing does do something in your brain and it affects your nervous system. So But diaphragmatic breathing, what happens is your diaphragm is like the shape of a dome. And when you do diaphragmatic breathing, it flattens out and it actually activates the vagus nerve. And so it can help heal that pathway. But that pathway has to be retrained. So it's really important that you do these breathing exercises several times a day until you can retrain yourself. Now, I have a long history of dealing with anxiety and depression, and I have overcome the worst of it. Occasionally, I still deal with a little bit. I mean, I just losing my little dog Gracie, that was pretty anxiety producing for me. But I find that when I'm stressed out, like I've trained my body, my breathing to be shallow. That's not good, because when you do the shallow breathing and your breathing stops like here, first of all, you're not getting air to the base of your lungs, and your diaphragm is not flattening out enough to really like trigger that vagus nerve. So it's really important to get your breathing to be belly breathing, where your belly is going out. So if you put your one hand on your chest and one hand on your belly and you lay flat and you try, it's hard because you're thinking about breathing, you're going to breathe differently, but do it several times a day. Just kind of watch and see what rises. Is your chest rising, the hand, or is the hand on your belly rising? Now, if you're like me and you have too much weight on you, the hand on the belly is going to start higher than the hand on the chest. So forget that. Just watch and see how it rises. But anyways, the goal is to get the hand on your belly to be rising more than the hand on your chest. And the hand on your chest should stay relatively flat. One of the things that also contributes besides stress to shallow breathing is poor posture. And we are horrible about posture in our life nowadays because what are we always doing? We're always hunched over on our phones. Okay, terrible posture. We're looking down at stuff. We're looking over our desk, looking at on our computer. Okay, our posture is terrible. And when we have that kind of sunken in posture, our back is like this and our gut is, we're basically applying upward pressure on our diaphragm. And that does not allow a full deep breath and allow the diaphragm to flatten. So watch the posture. This is something I'm working on for myself, is because I'm just as guilty as everybody else, is very poor posture. So it's really important to do the breathing. So the square breathing, it's easy to remember because you just have to remember 4. Okay, 4 sides to a square. You're going to count 4. 1, 2, 3, 4 each time. So you're going to, and honestly, I don't say 4 seconds because I think you need to start at a pace that you can do and then work up. The goal is to slow your breathing down, get your breathing to be deeper so that you can get more oxygen in. Oxygen's important. Okay, here's another fact before I go through the breathing. Your body, your gut is very sacrificial. So when there's not enough blood flow to your gut, your vascular system is going to shunt the blood out to your brain, up to your heart, to whatever part of your body needs it. When you deprive your gut of oxygen and you don't breathe enough and you're providing less oxygen to your body, your gut is what gets sacrificed. Because top priority is your brain and your heart and your lungs and your vital organs. Your body is going to shunt the blood away from your gut. And so when you don't have enough oxygen getting to your gut, peristalsis slows down. A lot of people end up constipated or they end up with problems and gut pain. So it's important. Another aspect of the deep breathing is not just to stimulate the vagus nerve, but to also get that oxygen down there and to get plenty of oxygen into your system so that your oxygen can reach your gut and it will stop shunting it away from your gut. And if you do this breathing enough, you'll probably notice that you will hear gurgling in your gut. Like things are going to will start moving. So you're going to do inhale through your nose to the count of 4. Hold for the count of 4, exhale, and you can do it through your mouth or your nose to the count of 4, and then hold to the count of 4. So I'll show you an example. So I inhaled, held, exhaled, held. Probably was a little more than 4, but you can count in your head, and that's it. And you do that for about a minute, like 3 times a day, 4 times, 5, whatever. It's free. It doesn't cost you anything, but that will help retrain you to breathe more deeply, will help lower that diaphragm, stimulate that vagus nerve, help bring good blood flow into your gut and get things moving. And hopefully it won't take too long to retrain, but be patient with it. And hopefully that's going to help with your irritable bowel syndrome. I think that's it for today. I just wanted to have this talk about IBS. It's a really important topic, and I don't want anybody who has irritable bowel syndrome to feel as though they're being dismissed because they don't have any sort of pathology or any sort of something visual that shows, look, this is what I have. It is a condition where you have to rule out other things, but it is a real condition, and so many people suffer from it. So I hope that this helps. Let me know in the comments if you have any feedback for me, and if you found this helpful, give me a thumbs up. Hope everyone's having a wonderful day. Take care. Bye-bye.